Good morning. This is Mark Epp with 318 Insurance, and just wanted to come to you today with a little bit different of a video. We're going to be talking today about a message specifically for doctors and those that are in the health care profession about the need for y'all to really look at Medicare Advantage. And we would appreciate it if you would like and subscribe to these videos. We're trying to get this information out as best as possible to as many people as possible to help them make good decisions with regards to their healthcare choices and their insurance choices in general. Again, we're with 318 Insurance. We're out of Shreveport, Louisiana, and we think we've got a really maybe not completely unique, but a good approach to the need for insurance and things of that nature. So this video is specifically geared towards doctors, and we would like to ask that if you know any physicians or doctor's office personnel, that you could send this to them, have them take a look at this, because we think that this is really an important thing. I have a good friend of mine who is a physician here in our local community, highly respected, with a highly respected group of doctors. And up until about 4 years ago, they had never taken a Medicare Advantage plan. And there was some history to that from back when Medicare Advantage first started and some issues that they had. And I asked this doctor if I could just take 30 minutes of his time. And he allowed me to do that. He's a good friend of mine. So I spent about 15 minutes talking about the A, B, C's, and D's of Medicare. And y'all can look at that video that we do. We want everybody to understand what Medicare consists of and the landscape that it's at these days. And what we did at that point in time was I said, hey, I want to take this one step further. And the reason is because when you get into the A, B's, and C's of Medicare, you see where the Medicare supplement fits in versus the Medicare Advantage plan. The scariest thing to me is somebody that is on original Medicare with a prescription drug plan and nothing else. The problem with that is that the scariest number in all of Medicare is the 20% Part B coinsurance that you're responsible for. And the reason why it's a problem is because there's no cap on that. And so I talked to him about this fictitious patient of his named Mrs. Smith. And I said, since Mrs. Smith has been a patient of yours for many years, she trusts you, she likes you, she wants you to be her physician. The problem is that Ms. Smith is on a Medicare supplement plan. And when she went on that Medicare supplement plan, when she first got on it at age 65, she was paying $100 a month, and she had the resources to take care of that without any problem. And then as time went on, maybe she moved plans once or twice. Her health would allow her to do that. But there came a point in time where she had a diagnosis that kept her from being able to get a new Medicare supplement plan. And she got hit by durational rating, which is a standard thing that happens with every Medicare supplement plan. And that is the real negative towards Medicare supplements, is that you get stuck with a plan that you're on and it continues to increase in cost dramatically. It is usually an exponential increase in cost as you go through time. And she'd been on this plan for 6 or 7 years without any ability to move to another plan. And her premiums had gone from what were 100 and then 115 and 125. Now they're somewhere between $275 and $300 a month. And Ms. Smith simply does not have the resources to pay for that premium. And what's going to happen is one of a couple of things. The first thing that she could do is she could keep her Medicare supplement plan because she sees how valuable it is, but then she's not able to pay for utilities, property. She can't pay for food. She's struggling on the backside because you've got an increasing cost of a service that she's paying for that is just taking more out of her budget than can be. And right now, with the way that inflation is going, that's a very real sense that happens to a lot of people. Second thing she could do is she could just drop her Medicare supplement plan altogether and just go stay your patient, come keep seeing you. And those doctor visits usually aren't a huge deal. It might be $100, $200 for a doctor's office visit with a lab panel and everything, and she's responsible for 20%. She can handle $20, $40, $50, $60 every time she goes in to see you. That's usually not an issue. The problem is that if something significant were to happen and she needed a hospitalization or specialist and some testing and things of that nature, that's where she would be in a real bind. The third thing that could happen is that she realizes that she can't have that much financial liability of being just on original Medicare without any type of supplement out there, and she hears about this Medicare Advantage plan. And she goes in and she talks to an agent, and the agent tells her, yes, the only problem is your doctor doesn't take those Medicare Advantage plans or a specific one that they might sell. And what happens at that point is Ms. Smith has to make a decision. And Ms. Smith sees the potential vulnerability of herself on original Medicare and says, okay, I need to make sure that financially I take care of myself, so I'm going to go to this Medicare Advantage plan. And she probably is not going to tell you that. She ends up going and finding another doctor, and the next thing you know, you haven't seen Miss Smith in a year or so, and you wonder where she's at. She is getting her healthcare needs met by somebody else. And that is the problem with not getting into the Medicare Advantage space. If you look at it over time, and we tell clients this all the time, they start out with a Medicare supplement plan. Sometimes that works for a year, sometimes that works for 5 years, sometimes that works for 10 years. But if you're blessed to live long enough, the probability of you being on a Medicare Advantage plan at some point in time in your life is pretty high. And we see more and more of those people moving earlier and earlier, and it's for a couple of reasons. One, they see the financial side of it. They see increasing Medicare supplement costs. They see lower benefits that are coming from the Medicare supplement side of the world. And they see the extra benefits and everything that they can get from the Medicare Advantage side of the table, and they do that. The problem is that doctors typically don't see that until it's too late. And one of the things that I want doctors to do is two things. One is to be proactive about their business, and two is to be profitable. This physician that I showed this to and told him what was going to happen to those clients, he had seen it before. He didn't understand what was happening at the time. But when he saw what was happening, he looked at it and he says, I never realized this. And that's the thing, that's the message that I want to give to physicians and physicians' offices is we're going to do everything we can not to try to practice medicine. Why? Because we're not qualified to do it and we're not licensed to do it. And we would want you to recognize that a physician or physician's office that's practicing insurance is in the same thing. You don't understand the entirety of what's going on. And because of that, we want to work with you. This physician, he saw the need to do something. About 6 weeks later, I got a text from him. I was in my office one day in a meeting. I got a text that said he had decided to bring this carrier on for a Medicare Advantage. Subsequent to that, he's added one more carrier. Now, we've got 5, 6, 7 carriers in our market. He does not contract with all of them. He only contracts with the ones that he feels comfortable with contracting. And it's good to have maybe 2 of those, and you can cover most of the bases for most of your clients with 2 of those. But he's had a very good experience with Medicare Advantage since he walked into it in the way that he did, with the mindset that he did. And I think it's important for doctors to recognize that in order for you to stay profitable and to stay in business, you're going to have to take care of these individuals as they move through the process of getting onto Medicare, being on a potential Medicare supplement, going on to Medicare Advantage. It's one of those things that it is a normalized situation. 10 years ago, Medicare Advantage was not the norm. Now it is. In fact, you've got more people on Medicare Advantage plans than you do have on original Medicare with Medicare supplements these days. And I think it's just important to realize that the nature of Medicare has changed to a point where we have to change with it as well. Now, what I would say to you is if you need some help with evaluating some plans, looking at some options, we'd be more than happy to try to be a resource for you for that. We do have connections to all the carriers out there that we're contracted with. We want there to be a robust network of doctors out there. And if you're a quality doctor, we're going to do everything we can to help get you in a situation and comfortable contracting with a carrier so that you can do that. We have experience in that. And so because of that, use us as a resource as you can. The imperativeness of this for the doctors is really important. And I don't want you to have to run through these decisions. I like walking through important decisions, and these are important decisions. Anytime you're signing contracts, it's an important decision, and we don't want to be rushed through that process. So one of the things that I would encourage you to do is reach out to us, reach out to other doctors that you might know that might be on some of these plans, get their opinions of them. Reach out to your patients and talk to them potentially about what they're seeing out there. You're going to have patients that are going to be able to tell you the struggles that they're having with regards to their healthcare costs. One thing that we want to make sure that we don't do is have that little Miss Smith that is just on original Medicare, because original Medicare is, if you ever hear of anybody that is on a senior that is on Medicare and they're going into financial poverty, it's simply because they have original Medicare and they do not either have a supplement or an Advantage plan. And we don't care which one they have. We just want them to be comfortable and understand the positives and negatives and the benefits of what their options are. And if you look at every single one of the options that are out there, there are goods and bads and uglies to everything. And our job is to help them understand a plan that can give them the goods, limit the bads, and to avoid the uglies. That's the important thing that we try to do. And one of the things that we do when we evaluate plans with members, is important for doctors to understand how we do that. We look at three things in this order. We look at providers. That's the hospitals, that's the doctors, that's the labs that they're going to, that's the pharmacies that they have relationships with. We look at those providers. That's the first P of the three Ps. The second P is prescriptions. It's important for us to look at what prescriptions they're taking and make sure that those are covered in a way that they're on a formulary, two, they're covered in a way that's advantageous to them. The third thing is we look at plan design. We plan until we have dealt with the first two of those things. So that's what we're doing on our side of the fence. We want to help you to have a strong and stable business as well. So share this with your friends. Let's get a discussion together. If you want to reach out to us, feel free to do that. Our phone number here in Shreveport is 318-629-3777. You can get with us, and we'll be more than happy to walk you down that road. Or reach out to us on our website. It's 318insurance.com. And you can connect with us through that. This is a unique video that I'm doing today that is specifically for that medical professional and that medical professional's office. And we want to have a good relationship with you. We want you to be positively impacted by the things that we're doing every day as well, because you're important to us and we want you to know that. Like and share this video, subscribe to our channel so you can see more and more things that we're putting in the pipeline here. Try to educate everybody that's out there in this space. So we hope you have a great day, and God bless.